Hello everyone, my name is Tawny Pratt, and this is my PowerPoint on the thoracic cavity. So your thoracic cavity is a protective barrier against trauma. It's made up of ribs, a pair of clavicles, a pair of scapula, and a sternum, also known as the breastbone. Within this protective cage are some pretty vital organs and arteries such as your heart and your lungs. So let's dive into the bones of the thoracic cavity. We have a bone that sits anteriorly in the thoracic cavity that we use for CPR on patients. It's called the sternum, and it's broken up into three sections. So most superiorly will be the manubrium, following that will be the body, and then most inferiorly will be the xiphoid process. As mentioned before in the previous slide, the thoracic cavity has a pair of clavicles, also known as collarbones. They articulate with the manubrium medially, and then laterally they articulate with the parascapula at the acromion. We each have 12 ribs, unless we're lucky enough to have 13 or more, which get broken down into three classifications. So we have true, false, and floating ribs. True ribs are considered 1 through 7 ribs. They have their own costocartilage articulating with the sternum. False ribs are going to be 8 through 12, but 8 through 10 share costocartilage with the true ribs, so they do not have any individual costocartilage articulating directly to the sternum. And then the floating ribs, which are 11 through 12, have no costocartilage whatsoever, but they are also classified as false ribs. So here's a picture showing everything that I previously just explained in the past slides. We have the manubrium here. This will be your sternal angle, which is the connection or articulation between the manubrium and the body, which is the body here. And then we have our xiphoid process, and our heart would usually sit right around here, which is why I say we use this bone for CPR. And these individual little blue things right here, this is your costocartilage. So you can see 1 through 7 each have their own individual costocartilage articulating with the body and the manubrium. So all of this here is your true rib costocartilage. Let me erase all this real quick. So then you can see 8, 9, 10, 11, 12, these are all your false ribs. So you have 5 false ribs, but 8, 9, and 10 each have their costocartilage, but they share it with the true ribs. So that doesn't have any articulation with the body down here. And then you can see here, 11 and 12 don't have any costocartilage whatsoever at all. So before mentioning, we have the clavicle, which articulates with the manubrium medially, and then at the acromion laterally. Let's talk organs. And no, not the nice instrument with the cool keyboard and the fancy pipes. I mean body organs, specifically within the thoracic cavity. We have 3 organ systems housed inside this protective cage. Starting with the digestive system, we'll talk about the esophagus. It's a collapsible organ roughly around 10 inches long, sits posteriorly to the trachea and the heart. And after all that, I need to take a breath. Whew! Which leads us right into the respiratory system. Starting with the trachea, it sits anteriorly to the esophagus and bifurcates into the left and right bronchi, feeding into the left and right lung. Did you know that the trachea has about 20 cartilaginous rings that keep it from collapsing? That would be breathtaking. Moving on to the lungs, we have a right and a left. The right side has 3 lobes, while its partner in crime only has 2, due to its roommate with a big heart. Which leads us to our last organ system within the protective cage, the circulatory/cardiovascular system. The heart and great blood vessels supply you with traveling oxygen in your blood through the 4 chambers in your heart. Broken up into 2 sections, we have atriums and ventricles, and just like the lungs, we have a right and a left of each. The heart has many roads and tunnels. Secured within the pericardial sac and surrounded by the lungs would not only be your heart, but also your major veins and arteries. Do you know that some people say they wear their heart on their sleeve? Crazy, right? Anywho, let's talk about the major vessels. The heart pumps oxygenated blood all over the body and receives deoxygenated blood from the body. Normally, arteries carry oxygen-rich blood, such as the aorta, while veins, such as superior vena cava, inferior vena cava, carry oxygen-poor blood. but there's a small role switch when it comes to blood and the lungs. The pulmonary arteries carry deoxygenated blood to the lungs, and the pulmonary veins carry oxygen-rich blood back to the heart to be transported to the body. So this is a great picture showing you the different arteries and veins that go to and from the heart and carry blood and deoxygenated blood and oxygenated blood to and from the heart. So we know that typically deoxygenated blood is carried through the veins to the heart, and then oxygenated blood is carried in the arteries away from the heart, but it kind of flips a switch when it comes to the lungs. You can see this blue here. This is your pulmonary artery, your left pulmonary artery, and your right pulmonary artery. This is carrying deoxygenated blood away from the heart and into the lungs to get oxygenated. Then coming back, you have pulmonary veins, these red veins right here, your left pulmonary veins, coming back into the heart with oxygenated blood. Crazy, right? Flips the whole switch. But this big aorta right here, this is your aortic arch. This little arch that I'm drawing here, they cut it out for the picture. This is your aortic arch, which takes all of your oxygenated blood and sends it all the way down to the rest of your body. Then coming back from the body, you're going to have your superior vena cava here, which takes in your deoxygenated blood from the superior portion of your body, so your upper extremities and your head and neck. And then you're going to have your inferior vena cava, which takes deoxygenated blood from the lower extremities or abdominal area and back into your heart. So these are just some of the exams that we can do or perform to see the thoracic cavity. Chest x-ray would be your best one to see the thoracic cavity due to the fact that you see pretty much every organ that I've talked about. Next up would be your rib x-ray. It mainly focuses on trauma to the ribs, any fractures that might be there, things like that. Lastly, we have our fluoroscopy exams, which is a live x-ray. One of the exams I can think of would be an esophagram, which is pretty much where we take contrast, the patient will swallow contrast, and we take pictures to see if there's any pathology, see any abnormalities and things like that. So these are just a couple pictures of the exams that we typically do to see inside the thoracic cavity. Starting on the left-hand side, this is a chest radiograph. This big, long area, darkened area. This is your lung. This is going to be on the left side. And then let's change colors here. This is going to be your heart. This is the heart shadow within the left lung. Got some ribs coming off the back, so the posterior ribs coming around here. We have our first rib right about here. Clavicles coming in, that articulating with the scapula here. Got a diaphragm down here as well. This is your diaphragm. Now on the right hand side of these two pictures, we have a fluoroscopic image, which is a live x-ray. And this is of an esophagram. This big long white tube, this is your esophagus. And the white that it's filled with is contrast that the patient has swallowed for the exam. So what kind of pathologies can you see within the thoracic cavity? There are so many pathologies that can be seen within the thoracic cavity, but I'm just going to list a couple. So within the lung, you can see a pathology known as emphysema. On a radiograph, it can show up as a flattened diaphragm, could be one sign of it. It's typically occurring with small changes into the small airways. Next up, you'll have a pathology of the heart known as cardiomegaly, which easily translates into enlarged heart. Lastly, within the esophagus, you can have a pathology known as Zinker's diverticulum, which is just an outpouching of the esophagus. As we wrap things up to a close, let's remind ourselves just how important the thoracic cavity is. This protective cage made from bones houses some of our most vital organs, from our lungs to our heart to some of our biggest vessels. And without it, we wouldn't get very far.